Welcome, everyone, to the Network for Public Health Law webinar, Advancing the Social Determinants of Health, the Private Sector Community Benefits Movement. We can go to the next slide. I'm Florent. I'm a staff attorney here at the network, and I will be moderating today's webinar. Next slide. Can we go to the next slide, please? Oh, back one more. Before we get started, I'm going to share our disclaimer. The network promotes public health and health equity through nonpartisan educational resources and technical assistance. Any materials provided in this presentation are intended solely for educational purposes and do not constitute legal advice. The network's provision of these materials does not create an attorney-client relationship with you or any other person and is subject to the network's disclaimer. For legal advice, attendees should consult with their own counsel. Next slide. We are joined today by 3 speakers. First, my colleague Phyllis Jaden will provide background on the social determinants of health and health in all policies. John Philo will discuss community benefit agreements and ordinances, and Linda Campbell will share more about community benefit agreements in action. We will have time for a question and answer session at the conclusion of the presentations, so please use the Q&A function at the bottom of your screen to submit questions. And we can move to the next slide, please. Thank you. A couple of housekeeping items. The slides and recording will be available within the next few days, and you will receive an email notifying you when they have been posted to our website. And as I mentioned, we invite you to use the Q&A function throughout the webinar. After the speakers present, we will try to answer as many questions as possible. I will now be turning it over to my colleague, Phyllis Jaden. Can move to the next slide, please. Phyllis serves as a Deputy Director for the Mid-States Region Office at the Network for Public Health Law, focusing on the areas of health equity and public health authority. Phyllis received a Bachelor of Science in Community Development from Central Michigan University and is a graduate of Wayne State University Law School in Detroit. Phyllis worked with the Maurice and John Sugar Law Center for Economic and Social Justice during law school and served as a fellow for the organization after graduation. She spent several years as a staff attorney for Lakeshore Legal Aid, where she also acted as an ombudsman for Michigan's My HealthLink program. Prior to joining the network, she worked for a private boutique law firm, concentrating her practice in the areas of civil and probate litigation. Phyllis has experience in the areas of probate, public benefits, housing, consumer protection, employment, and in protection from abuse. Phyllis, I'll turn it over to you.
Thank you, Susan, and thank you to our attendees for giving us your time today for what I'm sure you'll find to be a very interesting presentation. To begin our presentation, I'm going to take just a short amount of time. We want to make sure to focus on the meat of our presentation today with our other speakers, but I want to take a short amount of time to sort of ground this discussion and the topic in the public health space. If we can move to the next slide, please. So to begin, I just want to go over a few definitions folks may be familiar with already, but again, to sort of ground that discussion. This first definition is on equity. It comes to us from the Collaborative for Anti-Racism and Equity. That's CARE. The network is a CARE partner. And they define equity to be the assurance of the conditions for optimal health and well-being for all people. Achieving equity requires valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources according to need. Group-based disparities in health and well-being will be eliminated when equity is achieved. And again, that definition comes to us from CARE. You can learn more at herenow.org. We can go to the next slide, please. So health equity specifically is defined by the Robert Wood Johnson Foundation here to mean that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health, such as poverty and discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. These conditions are also known as the social determinants of health, and we'll touch on that more in a moment. If we go to the next slide, please. So you're probably familiar with the differences between equality and equity, and you may be familiar with either the image on this screen, again from the Robert Wood Johnson Foundation, or a similar image. But we like to say the differences between equality and equity is that equality sounds fair, but equity is fair. Equality refers to everyone being treated the same way. And that's going to be despite any personal needs or individual differences. There's an assumption with equality that everyone's going to benefit from the same supports. Equity, on the other hand, it refers to the goal of providing everyone resources as suits their needs to try to level the playing field and to improve everyone's chances for success. In the context of public health, success is going to look like living a healthier life. That's through things like safe housing, transportation, education, job opportunities, and reasonable access to things like whole foods and clean air and water. Again, items that make up the social determinants of health. If we could go to the next slide, please. This slide, or rather this image, comes from the CDC, and it just provides a more detailed view of what health equity looks like. It highlights here the need for accessibility. And in this snapshot, just in this snapshot, we have the need for access to safe green spaces highlighted. Medical care is mentioned, though telehealth is, of course, only a start to sort of remedying the lack of accessible medical care. And it also mentions access to fresh produce. And again, I offer this just to provide a better illustration of equity in the public health sense. If we could go to the next slide, please. And here, this slide does focus on the social determinants of health. This image comes to us from the U.S. Department of Health and Human Services, Healthy People 2030. Healthy People 2030 sets those data-driven national objectives to improve health and well-being over the next decade. So the Healthy People 2030 definition of the social determinants of health is that these are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. I have another definition of the social determinants of health. This one is from the CDC, and it's similar but different enough that it's worth mentioning. The CDC defines the social determinants of health as the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, work, live, worship, and age. These conditions include a wide set of focuses and systems that shape daily life, such as economic policies, development agendas, social norms, social policies, and political systems. The CDC adapted this definition from the World Health Organization. So, in other words, health starts in our communities. Health starts in our homes. Health starts in our schools, in our places of work. Those opportunities to be healthier and have better health outcomes, they start long before medical care is needed, long before any injury or illness arises. Better health starts with being physically and emotionally safe. Better health starts with having affordable and accessible whole food options, having employment opportunities that pay a living wage, having schools with resources to provide robust educational environments, just as some examples. If we could move to the next slide, please. Better health also comes with freedom from the impacts of racism. Multiple studies have shown that these impacts are associated with poorer mental health. It includes depression, anxiety, and psychological stress. They're also associated with poorer physical and just overall health. There is much to be said, and a lot has been written, of course, regarding the intersection of health equity and racism. And we encourage you to explore materials on these subjects, generally at the network's website, at the websites of our other speakers today from the Sugar Law Center and the Detroit People's Platform. I am just speaking for a short time today, so I just want to mention that we know that our country's history, our practices, our systems, our structures, our institutions, our treatment of people has led to conditions that are just much worse for communities of color than for others. These communities are part of the community as a whole organism, because it's a whole organism that works together. And they need support so that communities themselves can lead the way to these better health outcomes. And by supporting historically disenfranchised communities to improve these conditions that we've been talking about, that will help us make progress towards health equity. And to make progress towards health equity, make no mistake, is to make the entire community healthier, again, as a whole organism. The healthier the most disenfranchised groups become, the stronger the community will be as a whole. The image on the screen, this is from the CDC, and it illustrates pursuing health equity and that it can lead to a healthier community, which includes things like affordable housing, accessible green spaces for those with mobility limitations, and meaningful options to access preventative care during working hours. Again, just as some examples. If we go to the next slide, please. So this figure comes from the Kaiser Family Foundation, and it just lays out some more concrete examples of these social determinants of health. And as you can see from the figure, of course, healthcare is a factor in health outcomes. But healthcare has been estimated to account for only about 20% of those outcomes. The other social determinants of health have been estimated to account for the rest, up to 80%. These figures are compelling. So much so that folks in the public health space are certainly taking notice of these conditions we've been talking about and how important they are. But we also acknowledge that most policies that impact these conditions, these social determinants of health, they don't come from and they're not implemented by public health, even though they drive health outcomes and the majority of health outcomes. In that way, that makes most policy really health policy. So then we have a need to improve public policy, or excuse me, public health in policy areas that are not traditionally connected with public health. So what do we do? You can go to the next slide, please. That's where health in all policies comes in. Health in all policies is an approach that has come up in the context of efforts to improve health outcomes and to progress health equity by targeting the social determinants of health. On the screen, I have a image from the Association of State and Territorial Health Officials, ASTO, and ASTO's Health in All Policies Steering Committee defined health in all policies as a collaborative approach that integrates and articulates health considerations into policymaking across sectors and at all levels to improve the health of all communities and people. We can go to the next slide, please. So this health in all policies approach, it acknowledges that most public policies that impact these conditions we've talked about, the social determinants of health, they're made outside of health departments. So to improve these conditions, policymakers have to consider public health consequences of all law and policy, not just that law and policy that focuses on or relates to health. Like it says on the screen, in that way, most policy is health policy. So the premise of this health in all policies approach is to just lean into this, embrace this fact, encourage collaboration within and across agencies to improve those health outcomes and to advance health equity. Community benefit agreements, which you're going to learn about more shortly, embody this health in all policies approach. If we can move to the next slide, please. And this is my last slide here. Again, I don't want to take up too much time, but this last slide, it also comes from ASTO, and it illustrates that concept of the triple aim of health equity. So it includes expanding our understanding of what creates health. That includes those social determinants of health, the conditions we've discussed, and strengthening the capacity of communities to create their own healthy future. That's going to involve the implementation of that health in all policies approach, as well as close work with community-based organizations so that community-based organizations can lead the way. At the center of that pyramid, that's the concept of social cohesion. We need to come together in order to be stronger as communities, to approach expanding our understanding of health, again, including those social determinants of health, in order to implement this health in all policies approach and improve health outcomes. The takeaway here is that it's the responsibility of everyone. Health is the responsibility of everyone, and all systems need to be engaged. And the only way to truly move forward is for communities to have meaningful power and a seat at the table so they can lead the way. Community benefit agreements allow for just that. And they have the potential to greatly improve health outcomes by ensuring that communities have this power. It is a movement that was created for and is led by communities that have been historically disenfranchised, and it has already made an impact on these conditions that make up the social determinants of health. And it holds potential, or excuse me, immense potential to improve these conditions further. So now that I have discussed the connections between health equity and the social determinants of health and health in all policies, hopefully that sets the foundation for the real focus of today's presentation and makes it clear for everyone to see the need for those who are working to improve the health of their communities to be aware of the community benefits movement and community benefits agreements. So I will go ahead now and I'll turn it over to John and Linda so they can introduce you to this movement and to these community benefit agreements.
Thank you so much, Phyllis, for providing that foundation for today's discussion. Our next speaker is John Philo. And we can move to the next slide, please. Mr. Philo is the Executive and Legal Director of the Sugar Law Center for Economic and Social Justice. Mr. Philo's work includes representation of workers and low-income communities on matters of economic and social justice. The Sugar Law Center has been involved with the community benefits movement in Detroit since its beginnings nearly 20 years ago. Throughout, John Philo has provided legal and technical support to numerous grassroots community groups in negotiations with developers and in drafting proposed community benefits ordinances, community benefits agreements, memoranda of understanding, and other instruments. He is a member of the State Bar of Michigan's state planning body for legal aid providers, and his articles have appeared in publications including the Wayne State University Journal of Law and Society, the National Lawyers Guild Review, and the Willamette University Law Review. Thank you, John, for joining us today, and I'll turn it over to you.
Thank you, Susan, and thank you, Phyllis, for giving us that, sort of launching pad to go from today. As Susan indicated, I'm John Philo from the Sugar Law Center for Economic and Social Justice. I am the Executive and Legal Director. I wear a couple different hats here. I'm really, kind of excited and very honored to be part of this. I came up, just by way of background, I came up through, when I initially came out, I worked in tort law, and I worked in tort law for a firm that very much looked at it as a tool for for making a safer society, making people's lives safer at work, at home, and recreation. I think we lost that a whole lot, and I always remember looking at the early texts during the expansion of sort of products liability and tort law, and it was always put into a public health context in the early days. And I think we've lost sight of that in a lot of ways, in a lot of different legal areas. And I really think this is a very important grounding. My career has evolved and my tasks have evolved, and I've become involved in the community benefits work through my work here at the Sugar Law Center, which now is going on close to 20 years, I think it is at this point. We are a law center that seeks to advance economic and social justice for low-income people and their communities. And for us, when the community benefits movement was beginning to take hold, beginning to have inroads in Detroit, it was a really natural fit with our mission and what was sought to be achieved and responded to by community benefits concepts. I think before we dig in too much to community benefits agreements themselves, it's really important to where we situate this. Community benefits is it's a tool to address a problem. And it's a real tool, as Phyllis was saying, as a tool to advance equity and health equity for all in the context of economic development policies. The problem we face is the traditional economic development model, particularly in relation to larger projects. We see this at least throughout our community here in Michigan, but it's really a national problem. And it's a national problem in this way. The traditional way of spurring economic development is to give ever increasing amounts of subsidies to private developers, it started with tax breaks, it started with low-income land transfers to seizing land from private households to, now we're really on a, at least in my mind, is a death spiral. That for every large project the previous project becomes the baseline of the subsidies that we're going to give to the next project, and the next project is going to demand more. We've actually reached the point in Detroit where we're allowing private developers to capture income tax from the residents who will reside in a particular development project. That's the Hudson project downtown. A private developer is, just get your mind around that, is being transferred directly the residents' income tax that they would owe to the state or they'd owe to the city in different ways. But that comes on the heels of the previous tax captures, which is the tax increment financing, where, large portions, most of the benefits that accrue to from the increase in property taxes from a project would be transferred over to the Downtown Development Authority or whatever development authority was doing that. Now that, whatever merit there is to that to stabilize an area, the problem is they don't go out of business, and that's, particularly here in Detroit, you look at it, the Downtown Development Authority, the downtown is stabilized. It's been stabilized for quite some time. And you have a number of law professors and others now, and certainly community advocates who've been advocating that, where does this end? How long do we capture that downtown and not send that money out to our libraries, to our schools, to our neighborhoods, to increase the quality of life for the people who are actually living in the city? That's a very real problem, and it's a very real problem that's increasingly demanding a solution. Just to give you one example, you take the average stadium development. The average stadium development is pitched that we need to give the subsidies because it'll benefit the community as a region, not locally usually, but as a region, by the increased prominence that sort of the branding that those sort of sports teams give. As a major city or as a major regional hub. And then they'll talk about jobs. Well, the jobs transfer to construction jobs typically that are finite in time, finite in number. And while good jobs, certainly, and ones that we would certainly encourage people to have access to, traditionally the construction jobs are not going to the impacted community. In other words, the footprint where that stadium is. It's being dispersed. It's on a region-wide basis, and if you know anything about the building trades, there's a long history of exclusion of people of color and straight-up racism in a number of the locals in many places. I'm not talking out of school there, that's well documented. They're trying to overcome that, and hopefully they will. But that's the construct you're working in when you're saying we're going to create jobs through a stadium deal. Well, and then we say, okay, well, hopefully there's going to be long-term jobs out of that. But what are those long-term jobs? At the stadiums, increasingly what you see in our stadiums all in Detroit, they're staffed by volunteers. They're principally staffed by volunteers at this point. So you're talking about a handful of jobs, and when the city derives its money from increased property values, and that property value is siphoned off to the downtown, really you have to begin to question what that economic development model is doing for the community that is present and that is impacted. Community benefits seeks to address that. And it seeks to address that probably even beyond what I'm conveying here, in that it is directing towards the community that is most directly impacted by that economic development deal. Where do we locate large-scale projects? We locate them in low-income communities typically, where we can get land and where the city can acquire land and where developers can acquire land, at least on market rates, at the cheapest that they can. And what we do when we do that project is then we erase that community in very real ways. I use that term erase because that is what's happening. When we put that large project on, we're moving people out. We're moving them somewhere else. We're breaking down all the social structures that existed within that community, even if it was low income. It had networks of support, networks of mutual aid, small businesses, and in fact residences of people who live, work, and fought to sustain those communities under very difficult circumstances. So what Community Benefits seeks to do is give that community the power back, the power to benefit in a real and tangible sense from what is occurring when that economic development project arrives on their doorstep. And that's the goal. If we can, let's go to the next slide. This is a statement from the Partnership for Working Families. Partnership for Working Families was really one of the groundbreaking institutions, along with another one called Lane, working out of Los Angeles, and really were, you know, at the forefront of developing community benefits models there. And the way they state it is, you know, community benefits agreement is a project-specific agreement between a developer and a broad community coalition that details the project's contributions to the community and ensures community support for the project. That's the core right there. It seeks to do that by reaching an agreement between the developer and the impacted community that's legally binding and directly enforceable. And that, I do think, remains today in many ways the gold standard of what we're seeking to do through community benefits. Seeking to empower the community to be able to sit down across the table from that developer and reach a binding agreement where there's in exchange for the support of the folks most directly impacted, there's going to be real tangible benefits from that project to that community, not to the region. The region is what your government does in working on that, but to the people impacted directly. And that's what's sought. But as we'll discuss a little bit later, there's, you know, to get to the ideal, there's a long and winding path sometimes, and sometimes you have to take indirect routes. And this is a project, community benefits are a ever evolving project nationally and towards that goal. If we could, let's go to the next slide. This slide with its action bubbles that you see is just, you know, diagrams. What's the dynamic here that we're looking at? We're looking at community on an equal level with a developer. With the project is a tool for both. For the community, it's to see the impacted person to see real changes in the quality of life, real improvements in their daily lives, and then the developer gets in exchange from the community support for the project. Support from the community that should be matter is people who are going to be living next to it, people who will be losing public space as a result of it. And those people include, the impact included is broader. Residents is the most significant, most immediate component, but there's also displaced workers, there's also small businesses, there's also others who may be having, may be impacted by this project and its footprint in their, you know, in their space, in their living, recreating space. If we can, let's go to the next. Common provisions that we'll see in the community benefits agreements, you know, and this was a starting point in many ways when community benefits were getting started, but even today it remains core values. But things that, you know, jobs are always important. And to get that impacted community, it's a low-income community, typically a community of color, where, you know, access to jobs is critical, it's important, and it is, you know, folks have been excluded from the building trades, been excluded from other access points to the middle class and up. What community benefits do is seek to provide an opportunity for the impacted community to find a you know, an entryway point into those jobs, particularly first on the first level construction jobs, but then also the long-term jobs that the project is intended to support and create. In addition, affordable housing. With every one of these large-scale development projects, you're going to see housing displacement. And what the community benefits movement seeks to do is to end the process of erasing communities and seek a way to build sustainability. If there is going to be that large project, then build in affordable housing into it as an element. And affordable housing that's available not to the college-age students of the developers' children, but to the people who are directly impacted. Environmental mitigations are common, increasing public space, access to public transportation. All these are sort of subject matters that get baked into a community benefits model or agreement. If we can, let's go to the next slide. Keep saying if we can. I know we can, but it's just the way I speak. And this we look at, there's agreements. There's a great deal of agreements that are in place under that traditional model where a community group has come together, sat across from developers, and been able to negotiate a binding, enforceable, legal contract with the developer to bring access to local jobs, to bring affordable housing, and to do many other things for that community. Most notably, Los Angeles was groundbreaking that. The Staples Center was one. There's a port contract there as well. There's a number of residential developments there in Los Angeles that were able to achieve community benefits as well. And you saw it spread up and down the coast. San Francisco, San Diego, Oakland are all places that have been relatively advanced in terms of being able to get those private community benefits agreements between developers and community in place. And then it spread across the country. The other prominent places is along the coast, New York area, going up towards Boston and down through towards DC. You do see a number of very viable, very strong community benefits agreements that have resulted in and arrived. Now between those two coasts, it's hit and miss. It's different levels at different places. One of the ones that was fairly early on that was a real strength and source of showed that it could be done here in the Midwest as well was in Pittsburgh in relation to one of their arenas, and that's called the Hill District Agreement. Nashville recently did it in relation to their Major League Soccer stadium, and there's been other places as well, Denver and Milwaukee as well, have reached those agreements, but not at the level of density that we see on the coast. And this is what we've been struggling to, I shouldn't say struggling, but we're working towards here and throughout the Midwest and throughout other areas where these economic development projects are, communities often, the local governments feel beholden to try and chase them and pursue them, but to try and bring equity into that process. And try to break that sort of traditional economic development model by embedding community benefits within it. Next slide, please. The Pittsburgh arena, shows the idea that one thing is to keep in mind, there is no cookie cutter components of benefits that are sought. Those are actually the community driven. It is the community that determines the benefits that they are seeking, that they need, and that they prioritize. It is not an external exercise when it's done right. It should not be any nonprofits. It shouldn't be any government officials' list of priorities. It's the resident list and the local impacted person's list of priorities. And with the hockey arena, one thing that was, it was a creative agreement. We saw a grocery store come out of that. That's what they needed. The community needed that sort of grocery. So if you're in any urban area, you understand the concept of food deserts, and that was one feeling within that community that was needed. The First Source Employment Center was a great model there with that arena. The first source being that you're hiring from that local impacted community. They are the first source that you look to fill positions, to hire, to create apprenticeship opportunities, to do job training. And then there was others, a YMCA to get in there, creating additional public space, and such things as to increase, facilitate substance abuse programs within the neighborhood, which again was needed and helps to create sustainability within that community. So when we're looking at that community benefits model, we're looking at it to do those sorts of things for the community. It's a much more targeted approach than it is a regional plan. Next slide, please. And this just highlights, these are some of the places that you'll see community benefits agreements have been worked out and agreed to. And these are the traditional models. But if you see it's concentrated on the coast, there's actually quite a bit more bubbles than what you just see here. But it illustrates the point I want to make here, that you see a high density of concentration on the coast, and you see growing movement within the center. But there's also a difference in power balances in some of these places, where you have government officials, but also very strong community organizing and community support in certain, in some of the larger coastal areas than we see in the Midwest. It's a more difficult environment from which to build power for the community to force the developer to the table. And often it is forcing the developer to the table. So it's, and by forcing, I mean, you know, legitimate means, but means to make the developer understand the community's power and the community's willingness to wage the power that they have. And the community does have power. We often forget that, and people forget that, but they do when they act together for mutual aid. So it's a national movement, but there's different conditions in every different place, and those differing conditions have created some different responses. If we can go to the next slide. And the differing responses in a number of places has been sought to move to, or to use an ordinance model or policies or regulations of the city, of the local government, to try and leverage power on behalf of the impacted community. We really saw some of that here in a certain way, which I'll talk about later, in that Detroit was one of the first places to seek to leverage government power. Now, this is not a philosophy or a strategy that wasn't without discussion, and it wasn't without a great deal of debate, and it wasn't also, you know, some people feeling strongly that government should be removed entirely and remained removed, and others feeling that, look, there's different conditions in different places, and what we're ultimately trying to achieve is community power to achieve genuine community benefits. So if there's a government path to do that, then maybe we should avail ourselves of that. Now, where you've seen those sort of government ordinances, policies, regs, it's in different places. Detroit is certainly the groundbreaking and the first one to really have a fairly robust community benefits ordinance. And an ordinance is a, you know, as you know, is a local law, has the power of law. Where you saw others, Atlanta and Milwaukee, I think, were two that sort of used a legislative body approach, but it was only in relation to one specific project. In Milwaukee, it was Park East. In Atlanta, it was something called the Beltline Project. It was similar in Syracuse with the school construction. Where you really saw it was a one-off project where the government, which was, you know, approving zoning changes and such, required there to be some community benefits component within that development, required the developer to come up with, to meet with community and to come up with specific items to benefit that local community. But it wasn't broad-based in those communities. Those were one-off, directed to the particular project. Detroit was the first to do it broadly. All projects over a certain scale required to observe certain community benefits processes. Cleveland is the second one to do that, or actually Ypsilanti was the second, and I think Cleveland the third. But then St. Louis, San Francisco, it's kind of a policy approach there. I think Vancouver is a little more similar to that too, where they have a stated policy supporting community benefits, but it's not an ordinance approach, not quite the same. And St. Louis and San Francisco, those are in particular departments. I believe St. Louis is the sewer district. Any of their projects are required to have a community benefits component. In San Francisco, I think it was the public utilities departments that has that requirement. If we could, let's go to the next slide. I say there's different conditions. Now, Linda and I go back a ways, and we were there almost the earliest days in Detroit seeking, when community benefits were getting started here. And we worked a great deal, along with a number of others who were involved, but worked a great deal towards trying to get developers to the table with some very strong community organizing by Linda and by others, Reverend Ross as well, and many other people. However, getting developers to the table was a very challenging task. The developers and government, when we were getting started, community benefits was a foreign language to them. They had no idea what it was, and they had no interest in learning. And without leverage power to get them to the table, the ability to stop a project, it was just, there was a lot of, running into the wall and not getting past the starting point. The change, which was over time within the movement here, was decided, well, what if we think of an ordinance approach, something requiring developers to come to the community if they are seeking subsidies from the city? And after delays and fits and starts, it was thought to do that. And we developed a model ordinance. It was put before City Council, had strong support from several on City Council, but then it languished. Had a majority of votes, but was opposed by the mayor and never could get that final vote to get it passed. Or belief that they could get the final vote to get it past the mayor's veto. So then Linda and others led the petition drive, and our office provides support to the community. We're not the community, and we don't seek to be the community. We provide legal and technical support to the community. But the petition drive was successful, and it was a citizens initiative was certified for the ballot. It was fought the whole way by city officials. And then, unfortunately, what happened for us was one of the opposing council persons put a competing initiative on the ballot, which they're allowed to do, and that won by a very slim margin with the support of developers because they realized it was inevitable at that point. So we had a less robust ordinance than we had sought, but we had something. By the time that election day came, and it continues to this day, you now have a very sea change in the way that community benefits are talked at City Council and talked at developers. Where once they would never discuss it and pretended not to know what you were talking about, now even before the word go, they're talking about all the things they are going to do for the impacted community. Now, we want to see more substantive things rather than branding campaigns or, fairly thin community benefits. But that's a change, and that's a real change that has led to some substantive gains. If we could go to the next slide. This just highlights, I think I talked a bit about what is going on in the different cities and what particularly in policies and ordinances wise, and each of these areas have different varying things that have happened there. If we can go to the next. In this kind of a transition into Linda, these are principles, sort of the core principles that I believe the People's Platform or the Equitable Development Coalition came up with, particularly in talking about how we seek amendments to the existing ordinance. But the core ideas of the community benefits, whether it's agreements, whether it's a policy, whether it's an ordinance, is to get true representation, that it's representative of the community, the people who are negotiating with the developer, that it's inclusive, that it includes all the people who are impacted by this development project, that the process is transparent. This isn't about sweetheart deals between government and individuals or individuals and the developer. But it's a transparent process that's representative of the community, inclusive of the community, and finally, that's accountable. That the community can seek accountability for when benefits are not provided or agreements are breached. That has been a very difficult challenge, both in terms of ordinances, but also in agreements. We have been able to enter a number of what we'll call letters of understanding, but those aren't enforceable. And so accountability to the community is a real challenge under those. We've had a couple hold up. We've had a number also fall apart after a few years. So we're always seeking that enforceability, the accountability aspect. With agreements, a private agreement between the developer and the community, that's a contract. In the ordinance process, the challenge is breaking that accountability out of the hands of government officials. Unfortunately, here in Detroit, it is largely in place of the government officials at this point. We hope to someday have those amendments to change that, which should give, the idea would be, the change would be to give community, the ones who have felt the effects of a breach agreement, the ability to obtain some redress, some accountability to them for the developer's failure to meet those promises. But we haven't reached that yet. And cities, unfortunately, when it comes to enforceability against developers, are woefully inadequate across the country. When developers do not meet promised benefits, it is a rare day that you'll see any clawback in benefits or subsidies that were provided. In any event, I think that's about all I have for the moment, and I hope I haven't eaten too much of the time here.
Thank you, John. That was a great introduction to the community benefits movement and a good overview of what we're talking about today. And we can move on to the next slide, please. And I'll introduce our third speaker today, Linda Campbell. During the past 5 decades, Ms. Campbell has served in a variety of professional and leadership roles in public health and the nonprofit sector at the local, state, and national level. Her early accomplishments include supporting the organizing and leadership of local Detroiters in the formation of the nation's first Black grassroots AIDS service organizations, where members led one of the most successful HIV harm reduction models in the nation. Her later work in Detroit informed the seminal publication, Social Service and Social Change, a capacity building model that fosters service constituent power building and community change. Ms. Campbell served as co-author and national lead trainer along with her Building Movement national colleagues. And the guidebook remains one of the organization's most frequently requested publications and is used by many community-based health and human service organizations across the United States. Ms. Campbell currently leads the Detroit People's Platform, where the work focuses on community organizing, resident leadership development, and public policy. Detroit People's Platform has organized successfully with Detroiters to win groundbreaking public policies, including, as you just heard, the nation's first Community Benefit Agreement Ordinance and the Detroit Affordable Housing Trust Fund to expand affordable housing for housing insecure families. Ms. Campbell is a founding member of the newly formed Transforming Power Fund, Detroit's first social justice fund providing grants to increase funding for Black, Indigenous, and people of color-led grassroots organizations. Detroit People's Platform co-authored Changing the Conversation, aimed at encouraging philanthropy to increase investments in BIPOC-led organizing groups. She serves as a board member on several other social and economic justice organizations in the Detroit area and is co-editor of the award-winning A People's Atlas of Detroit, published in 2020, documenting the recent history of organizing and movement building in Detroit. Throughout her career, Ms. Campbell's work has been driven by a passionate belief in the collective voice and power of community members to shape and transform their communities for good. Born and raised in St. Louis, Missouri, she is a proud graduate of the Charles Sumner High School, founded in 1875, and one of the nation's remaining historically Black high schools. Ms. Campbell holds a master's degree from the University of Michigan School of Public Health. Thank you, Linda, for being here today. We're looking forward to hearing more from you about community benefit agreements in action.
Good afternoon. Thank you for that introduction, Susan. And thank you, John and Phyllis, for providing the context to my presentation. And thanks to all of you who have given up some of your day to come and sit and listen and learn with us. It's not often that I kind of wear my public health hat and my organizing hat. So this is a rare opportunity for me, and I appreciate that. Next slide, please. Next slide. All right, Detroit People's Platform, who we are. We're founded in 2013 in response to the state takeover here in the city of Detroit. In 2013, the state government decided that Detroit could no longer manage its finances and therefore brought in what's referred to as an emergency manager, which essentially upended our democracy and took over power of our locally elected officials. And so the People's Platform came together with advocates, residents, service providers from across the city to organize in response to that state takeover. We have always centered the priorities of majority Black and low-income households with children and continue that practice throughout our work today. Next slide, please. Just the key platform issues and alignment with the social determinants of health. During our founding convention in 2013, we pulled together folks from across the city to identify what are those priority issues that we want to work on, we want to organize and make sure that Detroiters are able to continue to benefit from city services in face of this austere move on the part of the emergency management. So our platform was formed in consensus with others from across the city. And as you can see, do align with some of the social determinants of health that Phyllis described earlier. Our sense is that the platform issues also help to build citizen engagement and citizen power, and again, to sort of hold on to our self-determination for our government in face of this the state takeover. This work really preceded the formation of the Detroit People's Platform, the formal formation of Detroit People's Platform, because in 2009, Detroiters began to go through a process of revising its decades-old city charter, which is like our city government constitution. And so we had, as a community, we had been forming and learning together and sort of figuring out what was our aspirational city charter to look like. And so a lot of the groundwork that served as the platform for the formation of Detroit People's Platform actually began in 2009, and the passage of what we consider to be a pretty progressive and innovative city charter in 2012 really set the stage for our organizing work moving through the emergency management. One of the defining aspects of the new charter is that it's squarely identified and defined city government as existing as a service organization intended to benefit and serve the residents, and that in fact, city local government is subservient to the priorities and the needs of its citizens. So those key platform issues, again, that we lifted up in the platform and can be located in parts of our city charter included public transit, investing in good government, equitable development, which is sort of where we seated our CBA and good jobs work, and then of course, affordable housing. Next slide, please. All right, Detroit, Michigan, the nation's largest majority Black city, although there does seem to be a bit of a debate. So if I have colleagues out there from Memphis, all right, we're tied and we'll settle for that. But once the nation's richest city, fueled by the automotive industry, which is something that a lot of folks aren't aware of, just the level of wealth that once existed in this city. That wealth in the automotive industry, of course, was driven by labor. And, I like to remind people that, everyday folks who got up and went into those factories and worked 20, 30, 40 years helped build this nation's industry and the middle class. And so our work is sort of rooted in that historical and cultural perspective. And a number of those who organize with the Detroit People's Platform have generational linkage to that reality. Therefore, Detroit is a space of progressive movements and radical Black politics. Whether it's the reparations argument put forth by John Conyers, or whether Detroit being one of the first cities to establish civilian oversight of its police department, Detroiters pride themselves on being willing to push the envelope and to fight for what they see are their rights as citizens in this city, and that's sort of a natural attitude that lent itself to the CBA movement and what we were up against. Many of you know that if you look across the country, those of you who are on board with us who represent or live in Rust Belt cities, you know about the downturn in manufacturing in the mid-20s, which kind of upended a lot of the Black middle class gains here in the city of Detroit. Detroit at one time led the nation, or we were pretty high up there in Black home ownership. The sort of decimation of labor and industry here in the Midwest and in Detroit really took a toll on the city. The disinvestment in many ways sort of set the stage for the 2013-2014 municipal bankruptcy and the imposition of emergency management. And so the context for the CBA work is rooted in Detroiters having to face not only the loss of its democracy, but also the decimation of its community and the long fought for economic gains that we had won over several generations. The result of the bankruptcy and emergency management, the recovery plan, and John spoke to this a little bit in his presentation, sort of the economic development model that emerged really was the formation of two Detroits, and we like to call it the tale of two cities here. Next slide, please. I included this slide just to sort of illustrate over a decade of what that strategy for economic development has actually resulted in. Again, this map illustrates where a lot of the development has taken place, the investments, the type of investments, stadiums, luxury high-rise apartments that resulted in the displacement of longstanding Black communities and residents living in those communities. At this time, I think when we look at what's actually the level of investment in downtown, midtown Detroit, we're coming up on nearly $1 billion in public investment. And a lot of that investment has been underwritten with public tax investments as well. And so what you have is sort of like the tension emerging between the Detroiters legacy Detroiters, people who have been here for generations, many, as I mentioned earlier, who had built family wealth and prosperity through the industrial model of manufacturing. They were being confronted by the shift in the economy. Detroit was eager to move to and towards the knowledge economy, the creative class, and invested a lot of planning and resources and business retention dollars into attracting those residents and those developers who were supporting that model. So next slide, please. And so what was the community's response to the level and type of investment that was happening downtown, Midtown at the same time that we were experiencing levels of disinvestment in the neighborhood? We were working, Detroit People's Platform was working in one of our local emergency food pantries where many of those clients, they were working households, depended on public transit to be able to get themselves to jobs, many of those jobs located outside the city boundaries. One of the hits to public service that occurred during emergency management was sort of the downgrading of our public transit system. So many of our clients would wait anywhere from 2 to 3 hours for a bus to get to work. And so they were looking at extended wait and travel times just to get a local bus, transport them outside of the city. And so this public transit issue had been a long-standing one for us and our partners working in the emergency food pantry. That is actually where the desire for a community benefit agreement originated. Initially, there had been a plan to establish a rail system that would run from downtown Detroit through the center of the city and along the neighborhood where the emergency pantry was housed. That created quite a bit of excitement for the residents in that community because we had been working with John at Sugar Law and some of our national partners, getting smarter about what transit-oriented development would look like. And that's how we kind of came to be interested in the CBAs. And so we had spent a good bit of time sort of organizing and getting our constituencies in that community ready for this, what we thought would be a transformational project, because not only would it bring development along that corridor, which would create opportunities for small businesses and jobs, but it would also help deal with the transportation problem so that our folks would be able to get to work. However, that got upended. And what replaced that plan and idea was we like to call it a streetcar, but a limited transportation options, transit option that actually only served Midtown downtown. It was an enhancement to the development projects that were going on there, basically to transport tourists and those who lived and worked in that community. And so the folks in the emergency pantry in that nearby community, they were locked out, which really created a lot of anger and resentment in terms of public benefit being used to fund a very narrow transportation project at the same time that many folks, workers, were depending and needing a more robust transit system that their livelihood depended on. And so the Equitable Detroit CBA Coalition grew out of that, the formation of folks, everyday folks in the emergency food pantry saying, we have to do something about that. We cannot have our public investment only serve the rich, powerful, and the newcomers. We need to organize. It was actually their desire to have an ordinance and to seek out support from City Council. The desire for an ordinance was their recognition of the limited capacity of folks in that community to devote the kind of ongoing organizing effort that would take place as these various developments came on board in downtown Midtown area, because we were aware that there were many developments that were taking place. And they also, folks in that community, believe that the government, in terms of thinking about our new charter, owed them that accountability, that it was the Detroit city government needed to facilitate a benefit process that would hold these developers accountable. So I just wanted to lift that up, that we had met with and talked with others who had done the more traditional CBA model, and the community decided against that and were very intentional in their desire for an ordinance, and worked with members of Sugar Law to help draft that ordinance. John was right in his earlier statement. We spent about 2 years trying to move this through the legislative process. At the same time that we were organizing and educating Detroiters more broadly about the CBA community benefit, because many of them not only were city council people not aware or pretending not to be aware, many in the community genuinely were not familiar with community benefits. So we used that time to do a citywide organizing and public education about community benefit agreements and why it was something that we needed to invest in and push our electeds to consider. We failed to move it through the legislative process. And again, the members of the CBA coalition decided to establish a ballot committee, and they said, we want to put this on the ballot. We want to bring this question before Detroiters and give Detroiters an opportunity to opt into this process. Fast forward, it was a hard-fought campaign. As John mentioned, they put up a competing ballot. I think our committee raised $11,000, and we were up against, at least I think I heard from some insider, our opposition spent about $1 million. And of course, they did defeat us, but they only defeated us by about 15,000 votes. We turned out almost 100,000 Detroiters to vote for the progressive, stronger CBA, which was Proposal A. But as John mentioned, we take it as a win because we got something on the books. We got an ordinance on the books that actually compels developers to come to the table once the development level is triggered to negotiate a benefit package with the community. And for that, we see that as a positive for our community. Next slide, please. So I'll do quickly because I really want to give folks an opportunity to ask questions, just to move through. Here's an example of a recent community benefit agreement campaign that we, Detroit People's Platform, and some of our long-term partners organized around. It's the Future of Health campaign. It's a $3 billion investment with $297 million in public investment. And that is our work. We organize and do the campaigns only when there's public investment. The developers in this particular project include the Detroit basketball Pistons, that I'm sure you all are familiar with, who are sports enthusiasts, Henry Ford Health Systems, and Michigan State University, one of our largest land grant institution here in the state. Their focus was building a new hospital and a new research center, and the Pistons were interested and are committed to building a new housing in collaboration with the hospital to provide this kind of live-work campus for to bring and attract medical and health personnel. And of course, this is mostly mixed use. There's commercial retail and green space. Next slide, please. Our organizing strategy. So what we always do is we assess the social, health, and environmental conditions in the impact area. And the impact area is that area that where the development is situated, and that is defined by street boundaries. When we looked at the impact area for this new project, which is to date the most expensive project here, a development project, it's a high renter population with a median income of less than $40,000 a year. It's in District 5, which is the neighborhood. It's the epicenter for development and displacement. And at the time when trying to see what were those priority issues we should focus on, affordable housing had emerged as a number 2 priority in a recent community health assessment in that area. Henry Ford Health Systems, in doing their community engagement and discussions around the development, had identified housing for Detroiters as one of their priorities. And so affordable housing quickly emerged as one of the priority issues that the community wanted to focus on, given the real threat of displacement for many of them. I wanted to make a distinction between the mandated community benefits that are required by the IRS for 501c3 hospitals. Some of you are probably familiar with that. That community benefit requirement by IRS also mandates that Henry Ford Health Systems completes a community health needs assessment. And out of that needs assessment, they develop an implementation plan to address priorities. They label those priorities as community benefits as well. Again, there's a difference between the community benefits that are triggered by the fact that they are a nonprofit hospital, it's an IRS requirement, and those community benefit priorities that are established by the community. One of our benefits was that Henry Ford Health System had identified investment in social determinants of health between 2023 and 2025. So we saw that as a leverage point for us as well. Next slide. All right, how do you build resident voice empowered? We worked along an 11-month timeline. We spent a great deal of time recruiting and training residents and community members for direct engagement in the CBA process. There was cross-sector collaboration. I've mentioned Sugar Law and the role that they played. Affordable housing developers who we met and talked with about what would affordable housing project look like in that community, and also community planners. We also looked at data, including doing a racial equity analysis to identify the negative impacts and harms, particularly for the overwhelmingly majority Black and low-income population. And we wanted to make sure that we avoided duplication of mandated IRS community benefits that Henry Ford Health System and the projects were already discussing. Next slide, please. So the outcome of the campaign, and where there's alignment with the social determinants of health, ensuring the basic housing needs and health of residents, supported and sustained by increasing access to safe and affordable homes in all neighborhoods. That's one of the major community health goals coming out of the Detroit Health Department. And so our organizing work and the negotiations with the community in the community benefit process lined up very well. The community was able to win rental assistance for individuals who were likely to be impacted by increase in rents or threat of displacement. We, first time ever, won a community land trust agreement with Henry Ford Health System. They own quite a bit of land in the impact area, and there's an agreement to set aside 10 parcels of land as a beginning to build out a community land trust. And as many of you know, community land trust is permanently affordable housing. It's a strategy to make sure that some of the residents do remain in that community, and that there is a diversity of income and race in that community in face of the major changes that are being planned. Those are two of the local neighborhood-specific benefits that were won. And then there was a larger win for a multi-year investment on the part of the developer for the Affordable Housing Trust Fund. The Affordable Housing Trust Fund provides funding to develop housing for low to very low income Detroiters across the city in projects that are developed across the city. And so it's both addressing residents' needs in the impact area, but with these large scale projects that scoop up hundreds of millions of dollars in public asset, we believe that there is a need to also win greater benefits that can have a positive impact on Detroiters citywide. Next slide, please. Cumulative impacts of the CBA, there have been 15 of these qualifying projects. The outcomes that we've seen is in building community capacity for inclusion in the process. Again, individual CBA projects at the neighborhood level with wins that work for residents as well as citywide benefits. And then here are some examples of further alignment with determinants of health, and that would be green space development. Some of the groups have negotiated for that. Each development project has its own individual negotiating team, so to speak. There have been neighborhood community funds set up, awarded by the developers so that groups can do their own kind of small mini grant making to further drill down on local neighborhood needs. Home repairs for healthier homes has emerged as one of the recurring demands because we have such old housing stock here in Detroit. Student scholarships, improvements in recreational space, involvement in youth and senior services, and then greater attention to environmental impacts. Next slide, please. All right, just quickly, the consideration, systemic and structural barriers, which is why racial equity tool is always advised when you're conducting these community benefit analysis and preparing community to make their demands. An acknowledgement of the power imbalances between community and the developers who bring all kinds of legal and financial folks to the table, in addition to strong support of our elected officials, and then the cross-sector alliances that are necessary in order to build out a strong, robust table. I think it's the final slide. Next slide. Lessons to share. Narrative building, building the power and voice of residents so that they begin to tell their stories about the impact of these developments, helps folks rethink development and what development should and ought to look like in these communities. As John had mentioned earlier, with Detroit really hungry for development and the promise of jobs, oftentimes the impacts of these developments are overlooked, and it's thought to be a worthy trade to bring jobs. And even though there may be harms to the community, having residents be able to talk about what those harms are like, and also to sort of build a story and a narrative about the kind of development that they want for their community was very powerful. Systems follow-up and accountability. The ordinance does allow for that. Yes, there's weak enforcement because these developers have a lot of power over our elected officials, but there is a process whereby community can bring an appeal to city council if they feel that a developer is failing to live into the CBA process. And then the readiness of community and community groups to engage in this process. These are long, arduous processes. Our community members are everyday working folks. They're raising their children. They're taking care of their elderly family members. They're engaged in other projects, building the capacity and elasticity of folks at the neighborhood level to take on these kinds of fights. It's worthy, but it's tough work, y'all. So I think that's it. Is that the final slide? Yes, thank you. Happy to answer any questions, either if we don't have time now, later on, if someone wants to hit me up on email, happy to do that.
Thank you, Linda, and I'll invite all of our speakers to come back on video for our Q&A session here. And Linda, John, you both touched on some of the kind of key takeaways, and Linda, you were just speaking about this, some lessons learned and opportunities. And we had a question come in wondering about monitoring and evaluation to track the impact of these agreements. Could you both speak to that a little bit more?
I'll speak quickly and then I'll step back for John. One of the ways that we've been able to monitor impact is through the Affordable Housing Trust Fund, because it is mandated that the developers make their agreed upon contribution to the fund. Those dollars in turn then help to produce the production of housing for families, many families who mirror those who are being impacted or threatened by displacement in the impact areas. So monitoring the follow through on with the developers, and then how those dollars then go to help fund and address the issue of housing displacement associated with these developments. John?
At least traditionally within the different models, there's typically the agreements, if you're going through the agreement model, there's a provision for reporting, and monitoring happens through meetings and that sort of reporting requirements. There's sort of two ways of getting to that, some ongoing monitoring is, a sort of nonprofit body that forms in relation to that community benefits agreement, usually from various representative groups that compose sort of a standing committee in relation to that project, or standing nonprofit, or existing nonprofits that sort of get, that the community entrusts to, oversee that on a sort of long-term basis. Within our city ordinance, the toughest thing is, the city somewhat controls the information that comes out. We're supposed to have some fairly robust reporting. I'm not too sure that we can fairly say that that happens all the time.
Yeah, it does happen, but you have to. It's dependent upon those who have negotiated the agreement continuing to put pressure on the city to be accountable around that. But there is a defined process, and they must report out on the status of the project and the implementation of the CBA agreement annually until all of the benefits have been implemented. So,
which is a heck of a lot more right than what we used to get.
Exactly.
Right?
Exactly.
As much as I can be negative about it, it's a lot more than we used to.
Yeah, it's an actual enforcement committee that meets. Yeah.
Continuing on this theme, thinking about kind of the long-term impacts and implementation of these agreements or ordinances, how can communities share in this shifted power over the long run? For example, John, you mentioned a grocery store. Is that store a co-op model that would ensure, costs are kept down and some community ownership of that? Or, are communities asking for these shared ownership opportunities during these discussions?
Yeah, I think that's fair to say they are. And there's different places, different models. That particular grocery store was, the various grocers submitted applications for the space to the community, the overseeing sort of community group, and the community chose which application to accept. But you really do see it in the jobs pipeline models, right? And that community members typically compose the process. They establish the process. They compose all the ways that this first source hiring sort of hall or process to go through. I think in every sense the community wants to be part of it. It's not delegated out, or typically not delegated out, or sought to be delegated out, except by choice, except where. What do you think?
I will just lift up the Future of Health campaign, and one of the really exciting outcomes was the establishment of the Community Land Trust as a benefit concession. And the Community Land Trust is permanently affordable, sort of community-owned, community-controlled housing option. And so we're really excited about that. And one of the things that we have modeled in this process is that we, in organizing with community, we tend to replicate those benefits that we think are produce systems change and do produce those kind of long-term equity outcomes for community. And so we, in addition to the Housing Trust Fund, we'll definitely be adding Community Land Trust as one of the benefits to be negotiated for.
Thank you. We have time for one more question, so I'll open it up to any or all of you to answer this. If you want to share just in the last moments here, your top recommendations for techniques to build the supportive infrastructure that might be needed to expand community capacity around community benefit organizing.
That's a hard question. Linda's the organizer here, but that's a hard question and it's dynamic. I don't think you can think of it statically necessarily. I often think of, why, in some ways, why don't we have as many private agreements? Well, one thing I think of, you need, for us, we need a component of a city that's willing to walk away from a deal. I can't think of any deal that our city council has ever walked away from. I used to work there. I mean, I can't, Now, I think in New York City, they reject it frequently, same in LA. But we don't do that. That would give community power.
More power.
Yeah. But, I think you have to think of it dynamically, and the local conditions will somewhat drive it. What do you think, Linda?
Yeah, I think until we change the economic development model in these cities, especially our Rust Belt cities, the public, the elected folks, they're going to chase those dollars. They're going to chase those investments. And so, this idea of what does an alternative economic development model look like? How do we bring more of our development work back under the power and control and decision-making of the public is one of the questions that we're starting to tease out and put in front of our elected officials, particularly housing.
Thank you to all of our speakers today. Unfortunately, we are at the end of time here, so we'll move to the next slide. Several of the questions were also answered via the Q&A box typed out. So if you submitted a question, there may be an answer typed out for you there. And thank you again for attending today's webinar. As I said at the outset, you'll receive an email notification when the slides and recording of the webinar are posted on the network's website. Feel free to reach out to us to connect about these topics and continue the conversation with us. And we can move ahead to the next slide. I also wanted to mention that the network's Public Health Law Conference is held every other year, and this year it will be in Seattle in September. We'll have over 40 sessions focused on core issues, including advocacy and community engagement, health equity, public health authority, harm reduction, data access sharing and privacy, and more. So we invite you to join us to learn, connect, and collaborate. You can learn more if you go to our website or scan that QR code there on the slide. And one more slide, I think, to close us out. Please complete the session survey. Thank you again for your attendance, your engagement in the Q&A. We look forward to continuing these conversations with all of you. And a big thank you again to our speakers today. We hope to see you at future events. And that concludes today's webinar.
Thanks all.
Thank you, everybody.